So, hello everybody. My name is Julia Grabsa. I'm the editor-in-chief for JACC's reports. And together with me is Dr. Minna Walsh. She's our deputy editor for JACC's reports, past president for American College of Cardiology, and also she's the director of heart failure and transplant in St. Vincent Center in Indianapolis. Minna, thank you for doing this together.
Absolutely, Julie. I love it.
So let's start. Actually, what we discussed, Minna, is that we are doing this webinar. It's a great timing because after a year of JACC case reports, we have learned a lot in clinical case writing and also social media. So I would like to start with the first slide. And when you're writing a clinical case, the first step is to read carefully the author's instructions. Make sure that you read all of them and what their requirements for the journal. And then you can decide actually if your manuscript is suitable for the journal. Also, because we have a variety of article types, make sure that you understand which article type it suits it best. So, and this we are talking about this because we started with a variety of article types such as clinical case series, clinical case global health reports, MDT live, but also we added few as we went through. We saw some clinical cases that were more technical, and we now have the technical corner, or some cases that they employ anatomy and 3D printing, and that's why we have Da Vinci Corner. So if you go to JACC Case Reports Author's Instructions, you will be able to see in detail what is each article type serves and how are the instructions. So this is very important because we see some manuscripts and we are wondering whether the author's instructions have been pretty clear for the authors. But how is important to submit an excellent clinical case? We suggested an appropriate structure, and this is coming through the years and through the experience that we got. This is simply a guidance for you to understand the case and to make sure you're not missing anything. So it's very important to have a clear, short description of the case as the title, to include the history of presentation, past medical history, differential diagnosis, investigations, management, and discussion, follow-up, and we are asking from you 3 learning objectives. But we will actually elaborate a little bit on them as we go, as we move along this presentation. First of all, history of presentation. Do not forget vital signs. We see a lot of clinical cases that they do not include vital signs, and with vital signs I mean blood pressure, heart rate, saturation, how the patient presented to the emergency department, for example. And this is very important because from my experience, I will speak from the imager's perspective. When we have a patient with aortic regurgitation or a complex disease or heart failure, we definitely need to have blood pressure in order to understand better how the hemodynamic lesions are managing. So also physical examination. It is important to understand if you examine the patient in emergency department. Let's say a patient is presenting with VSD. Did you hear a pansystolic murmur? So how did the patient present? Symptoms. So the patient presents in emergency department or in outpatient's clinic. Are they very sick? What are the symptoms? And for how long did you have the symptoms? But also it's important to understand the past medical history. So the patient was on any other previous medication? Do they have comorbidities? Did they have any previous operations? Did they have, for example, many admissions in intensive care unit? Then another important step is the differential diagnosis. And we kind of joke here is that it's unless you're Dr. House, unless you are someone who will spot on the diagnosis from immediately, definitely you have a list of diagnoses. And this, I would say, it's the most important part of the clinical case because we want to understand how you are thinking. What made you think that this is the final diagnosis, the one and only? Usually under this section, you will have the way of your thinking in order to understand whether it has to do with your country, For example, if you're coming from a developing country, maybe you have different differential diagnosis from another one. So it's very important to understand how you reach the final diagnosis. And this, in order to reach the final diagnosis, is important to list the investigation. So if you had an echo and cardiac MRI or an angiogram, why you did that? And when did you do that along the course? And what were the results? Here I will only mention that we see many cases that they list the figures. However, it is important also to have the videos when appropriate, because for a clinical case, and since we have the platform that can play the videos eventually, it's very important to understand the echo and coronary angiogram to have a conclusive view when, especially for peer review. So for management, it is important to understand how we manage the patient. Was it medical, or you include any invasive procedures? And which one did you choose and why? Also, if you had any complications, it's better to list them, because we learn from our complications. And we see actually a great percentage of our cases that they list complications. For the discussion, it's important to us to discuss how you associate with the current guidelines and the current practice. And if you went against the guidelines, please let us know why you did that, because it's very interesting to see, again, how each group manages the patient. Maybe you didn't follow the guidelines, so it would be interesting for us to learn from you. It's important to have an evidence-based discussion and even to provide any gaps in evidence, and to link, of course, with the manuscripts that they relate to the case. So as a general advice now, we accept either rare or educational value cases. Sometimes, if a case has a great potential to develop as an educational corner, then we will ask the authors to revise the manuscript. But if the authors state that this is a new case or something is extremely rare, just make sure that you do a literature search, because it doesn't mean that it's new to you and it's new to everybody. Also, it's important to do your best to revise for English language and to have a well-structured manuscript. The structure that we demonstrate to you is a sample on how not to miss anything when you write a clinical case. It's a suggested structure. Also, to include the learning objectives, 2-3 points on what someone could learn from the case. It's important to spell abbreviations. For example, I saw a clinical case yesterday that they didn't spell abbreviations. Of course, we wouldn't reject the case for that, but it's important to show that you look after your clinical case as you're looking after actually your child, or you're looking after a great manuscript that you're about to prepare and submit. To use terms that they are used worldwide, to provide also high quality imaging that it's supporting the information within the text. So when you write an imaging vignette now and you would like to combine multiple figures, it's important to create a multi-panel central figure. And also, as I mentioned, is that it's important to have the videos associated with echo and angiogram. Our platform actually accepts videos for a clinical case, and I feel it's a very important feature of the website and of course of the journal, because it's open access, so we have the videos there for you to understand better the case. Also, for a vignette, either it's an imaging vignette or an ECG vignette, we have the text to be 500 words because it's simple and straightforward. So sometimes we may ask you to revise your clinical case as an imaging or clinical vignette, and we do that because we might feel, for example, that has more of educational value rather than it's very rare. An immediate reject is when we see actually the authors have employed plagiarism, and that is copy-pasting whole paragraphs from other manuscripts. This is an immediate reject, is not acceptable in publishing. It's because we would like you to actually write your own text. Also, if the presentation is in the form of bullet points, and I will go to the first point, that means that the authors haven't read actually the author's instructions, or they feel that they can write a manuscript in the form of bullet points. A manuscript is narrative, so we would like you to explain what happened. Also, if there is no relevant imaging, of course, we will make an effort and we will ask the authors to provide the imaging. But if the authors do not have the proof of how they treat the patient, then it's impossible for us to make some conclusions about the case. In general, you need to make sure that you are looking after your manuscript and that your manuscript is up to the JACC standards of quality. But in general, also when you are about to submit a paper, it's important to have a checklist. Is the layout of the clinical case clear-cut and easy to read? Did you use the suggested subheadings if appropriate? Have you documented physical examination or differential diagnosis? And your discussion, is it associated with the clinical guidelines? Also, have you included imaging of high quality? And this is the last step. Make sure before you submit the manuscript to just look at your manuscript and make sure that you're doing a quick English revision before you submit. Sometimes, on version 3, when you read a manuscript, you might detect mistakes that you didn't know that you had from before. And so I will show you a few examples of authors that they did a great job in designing the imaging vignettes. And this is an example of a technical corner that the authors have combined 8 images in a panel. You can see an important point is that they use arrows to demonstrate the pathology, which is very important. If they didn't use, and when you design your vignette, your multi-panel figure, have in your background of your mind the question of how can I prove to a colleague who is watching, who will read this case from another country far away, how I can teach them on what were the findings of my patient. So use arrows, use annotations, make sure that they understand the anatomy, describe how is the normal physiology versus the abnormal physiology. Overall, teach us. That's the very important component of the clinical cases. And this is an example of the Da Vinci corner where we employ 3D printing. And on the left, we had a 3D model guiding transcatheter tablet replacement. This is a case from Saudi Arabia. And on the right, we have the editorial from Dr. Alejandro Jimenez, who is described again with, you see arrows, the anatomy. So this is the difference of an educational case versus plain case that doesn't have the arrows, that it has no educational value. And this is an example of an illustration, and these are credits to Dr. Babia Nazatrian, who made these wonderful illustrations. And we can help you even create these central illustrations because we think that these are the summary of a clinical case. So here is the most important bit. I can see also some messages coming about rejection and many questions, what's the rejection rate? I promise we will get through as many questions as possible. However, if you receive a decision from a journal that didn't reach enough priority, don't get discouraged. And if you have any feedback, try to correct your manuscript and resubmit to another journal. This is not the end of the day if you get the rejection letter from us. But keep trying. It's an opportunity for you to improve your case and to make sure that the case can be adapted for another journal and eventually to publish. Also, it's important when we see the senior person, a mentor in the case, to make sure that you will show to your senior colleague your case, your clinical case, to receive feedback. Is it indeed a rare case? Is it an educational case? Do they feel that it's worth being published? And this, I will just spend 1 minute to describe a little bit that every week we have an editorial board meeting, and every decision is a matter of democracy between 20 people. So the deputy editors, associate editors, and the editor-in-chief discuss all together every case. And if all of us agree that this case has a value to be published and it is important to be resuscitated or to be revised, then of course we will give the opportunity to the authors to revise the case. If, for example, there is a group that they have difficulty in English, there have been occasions that our editors help actually the authors to revise for English. So if we feel that the case is worth being published, we will help you actually improve your case. So now the next part, the next half of the lecture is social media, and I will ask Dr. Mino Walsh to take over.
Great. Thanks, Julia. Appreciate that. One thing I would add to the request that if we ask you to revise, I think importantly, we sometimes suggest that your manuscript, that your case is better for a different format. The imaging vignette is one. Also, MDT Live, which is multidisciplinary care we're focused on. We may see in your case a real opportunity for you to be able to highlight how your team made decisions, often difficult decisions in patient care. So when you get back a suggestion from the editors that you resubmit in a different format, please take that seriously and understand that the editorial board felt really positively about your submission. So with that, I just want to talk a little bit about social media and JACC case reports, and then we'll talk a little bit about social media in general. So why would we include this in the webinar? The reason is that we think that JACC case reports as a journal really lends itself to social media presence in a way that not all journals do, and so we wanted to highlight some things for you. What you see on this slide is the altimetric score of JACC case reports. This is from just our last Q2 from 2020. The altimetric score can be found in any journal. If you go to the home page and then go to an article, you'll see a little circle and you can look at what the altimetric score is. And this is composed of, in essence, both social media hits or what's happened on social media for that paper, in addition to other things such as news reports, news media reports. And you can see the top 15 articles from Q2 this year for JACC case reports. The top paper was the paper that described stent thrombosis in patients with COVID. And just if you're curious, if you've ever looked at an altimetric score before, go on and look at that paper and you'll see that there was worldwide interest in this, with the heaviest interest being in Spain, which was where the case was published from. So altimetric score is important to the journal because it really lets us know in a way that's different for a journal what kind of impact is being had. It's different than citations, which are rare for case reports, and it's very different than the impact factor. But if you get used to clicking and on the altimetric score for a paper you're reading, you'll get to understand how that's built. So again, we're looking at I think this is the first half of 2020. So these were the top 5 engaged Facebook posts. So the JACC journals provide a Facebook page, and you can subscribe to that if you're on Facebook. And also, we're going to get to Twitter, but there's a JACC journals Twitter feed as well. So these were the top 5 engaged posts, which mean that we got the most reaction from these. And you can see that a couple of them were already shown to you. The one on the left includes a really beautiful central figure describing the different types of cardiomyopathy and ways to investigate that. And in order to look at that on Facebook and interact with it, as you know, if you're on Facebook, you can like or make other comments about it. The next one over is, I think, also that might have been the Brugada's one. But anyway, the point on Facebook really is that you're able to see the cases and react to those. And you can see there's a great deal of engagement on Facebook. These are the top 5 Twitter posts, some overlapping ones from the Facebook. So these came directly from the JACC Journal's Twitter feed. Those of you who are on social media, especially on Facebook, especially on Twitter, may actually feel like you want to tweet something about JACC case reports or another journal as well. And keep in mind when you're looking at a Twitter feed on a case report, especially from JACC case reports, and look and see who posted it. Dr. Grapsip posts a lot of our cases herself. So do the other deputy and associate editors, and so do other people who are interested and might be in the same field as the authors. and they amplify those cases for us. But these are the official JACC journals engaged Twitter posts, and you can see there's a great deal of interest on social media in the journal. This is a leadership page that I wrote a couple of years ago during the time I was president of the ACC on social media and cardiology. And the reason I did that was because at the time and in the few years prior, there was really this growing interest in social media as a form of communication in all of medicine, but in cardiology in particular. And there's been a lot of engagement among cardiologists about, not just about cases, but about big trials and also other things that go on just in the public forum. And so what I did on this piece was actually engage several leaders in cardiology to comment on how they use social media and what they felt about it. Harlan Krumholtz talked about his use primarily of Twitter. Rob Califf, former FDA commissioner, put some thoughts together for this as well. Eric Topol, who's maybe the most prolific person on Twitter, who's a cardiologist. And also Sunil Rao, who started the hashtag Radial First. I asked Sunil to write about this because it was truly using social media in a way to engage a community around a topic. Basically, as he describes, if you want to read this leadership page, he describes that a few people got together early on and said, let's just post our cases and use the hashtag Radial First. And truly, social media is part of how the radial approach became more common, at least in the United States. I think it was already being used a lot in Europe. So those are several cardiology leaders to kind of just give you a little insight into how they have used and continue to use social media. So we've had other people weigh in on this. This was a really interesting fellows in training early career section piece that really stemmed from one of the fellows in training who, or I believe he's early career at the time, who was quite cynical about social media and wasn't a user at all. And he became involved in a program to encourage members of the college who are interested in education. He was involved in this program and had as a mentor Gina Lundberg, who's quite often on Twitter and uses a lot for education. And so they designed a program for him to actually become a Twitter user and find out what he thinks about social media and cardiology. You can read about his experience and her thoughts, his mentor, Gina Lundberg, what her thoughts are about this. This was a recent publication. So when we think about what's the difference between social media and publishing in a journal, so I think this is another really important piece that was published about a year ago now. So if you look at case reports, right there in the middle of the illustration, the point of case reports, as Dr. Grafs has already said, is truly that of, number one, medical education and dissemination of information. Also, some of the case reports we publish describe very novel pathology. An example of that, which I just mentioned, was the thrombosis, the stent thrombosis seen in COVID, which was a real novel presentation. Sharing innovative techniques, that is for sure our Da Vinci Corner. That's what that's really focused on. And then detecting beneficial and adverse responses to therapy that we want to telegraph to the community so that they understand it, and also understanding mechanisms. So traditional publishing in a journal, there are publication costs. There is a review process. It's not always prolonged, but it is rigorous. It is a limited medium. Some journals remain print only. That's not true for any of the JACC journals. Some are online only, as you're aware, as is JACC case reports. And journals can't accept all submissions. So on the other hand, social media is really, everybody can be part of it. You can be identified by your patients when you're on social media. You're really out there in the public space. You have limited text, so you can't, unless you put together a text thread, a tweet thread, you have a limited amount of what you, figure or characters that you can use. There is a little bit more of a risk of plagiarism in that people can kind of copy and paste something without giving any recognition to the original author. And you truly can lose control of a discussion on social media. So there really are pros and cons to both. And those pros and cons are there also when we're tweeting about the journal cases and about the journal manuscripts. But I think this is a really important contribution by Dr. Parwani, just kind of telling us the difference between, or underscoring the differences between social media and the journals. So I don't want to speak for all cardiologists or all people on what's called med Twitter, but some physicians feel that social media is truly an extension of the doctor-patient relationship, and really important to remember that when you're on social media, if you choose to engage, your patients are watching you. I'm always amazed on some of the Twitter discussions, how often patients jump in and weigh in with their own opinion about a given, not so much the paper that's being discussed or the scientific discovery, but oftentimes how they're affected by it and what their view is. There's a lot of feedback for clinical trial design, device marketing, and enrollment in clinical trials. Some are focused on patients, some focused on cardiologists talking back and forth to each other. I think that from the patient standpoint, however, what we see is a lot of information that can be pushed out to patients on social media. You can push the information to your patients yourself or use one of the platforms such as CardioSmart. CardioSmart is a patient-facing website, and CardioSmart has a separate Twitter feed from the JACC journals. And you can often share that information with your patients and, again, push that information out by retweeting or reposting. So it's a very interesting way to get access to information for patients. Patients can get very subspecialized information that they might not have otherwise if they were simply reading the lay press, because med Twitter and Twitter for cardiology really becomes very subspecialized very quickly, and I think it's a real learning environment for patients. Then lastly, there's on this slide, there's a lot of information on advocacy issues, public health issues, and policy. If you are interested in learning about health policy and understanding what's going on from an advocacy standpoint in many countries in the world, Twitter and Facebook are ways to access that information, because there is a lot of discussion that's going on right now about some of these type of issues that are not always discussed in the journals. So social media pitfalls, it is, I think, really clear that everyone today has an opinion on everything, which is not a bad thing. But no matter what social media platform you're on, or even in person, everybody's got an opinion. If you view something on Twitter or Facebook and you wonder if it's the real deal, if it's accurate information, make sure you look at who put on social media. If it's coming directly from a journal, you can understand that this is, or directly from the ACC, which is ACC. Julia, we can hear you a little bit. So you can either watch we can see where it came from originally, and then you can see what people do as far as retweeting and responding. So just be careful if you kind of wade into a discussion that you don't understand. Track it all the way back and find out who started the discussion. And are they referencing hard science? Are they talking about the statistical analysis of a trial, for example? So you're going to be in better stead if you're able to understand exactly where the information came from. Social media can be very cruel and harsh, and people can be very mean to each other. And if you're going to be posting, it's better to leave those things up. Be kind. Don't say anything to someone on social media you wouldn't say in person. It's not a great place to have arguments because it's a format that allows only a few characters. So being dogmatic and being bullying even is commonly encountered by many people on social media, including our young trainees. So make very sure that you're not contributing to that kind of a bad environment. If you're posting bad quality images and videos, really get us nothing. That's true, by the way, for the journal as well. JACC case reports. Often we like the case, but the images and the videos we are not of good quality. And sometimes you'll see us come back and say we really like the case, but we don't see the images and the videos. We can't see the point that you're making very clearly. Same is true on social media. If you're going to post an image or a video, you should be posting something that's very clear. Nothing should be discussed on social media about a patient without the patient's consent. It doesn't matter if if you're correct with regard to HIPAA in the United States, which means, oh, well, there was no patient identification on here. But if you're in your echo lab reading and you want to post something on Twitter, pick up the phone and call the patient and ask the patient if that's okay. If you had a chest x-ray or an ultrasound of some kind or any kind of test, would you want your physician or the radiologist to be posting it without your knowledge? I feel very strongly about this, and there's a hashtag that has evolved that says with consent. And I will tell you of one that I found particularly horrifying about a year ago. A physician posted an x-ray photo of a woman who was pregnant who hadn't known she was pregnant. And this physician chose to share that with the world with some fairly disparaging remarks about the patient. So I was almost certain that patient didn't know that a physician was passing that on to social media. So ask for consent either at the time that you're going to post something. If a patient sends you a lovely note, pick up the phone. Can I share your note with my colleagues? I won't talk a lot about overexposure with selfie-itis. Sorry. But keep in mind that if you want to post things that are of academic interest, you can dilute your message if along with that comes a lot of other information about yourself that you're posting all the time, but that's really a personal decision. So just decide when you're going to post kind of what you want your persona to be. But if you're going to be posting about medical education, cases, information from journals, remember that your own social media presence really should matter to you. I think I already covered most. Yeah, I think actually this is a little bit of duplication from our previous slide. So, here's an additional paper that was really interesting around social media in cardiology. And this was published in the journal some time ago now. And the authors called this the Kardashian Index of Cardiologists. And in it, and take a look at this if you haven't seen it, they looked at how prolific people were on social media versus what their engagement was and their in their academic work. And what we did as sort of a counterpoint to that piece was we actually asked again Rob Califf, he's a former FDA commissioner in the United States, and he is very active on social media, so he gave a perspective on the K-index. And then we also asked Dr. Tony DeMaria, who's past editor of JACC, to talk about social media and the impact in medical publications. So that got a lot of attention on social media after it was published, and so you might want to look at that as just an example of differing views on the use of social media in cardiology. So our take-home messages are really threefold. Clinical case writing is a mentoring process, and as Dr. Graps already said, if we decline your paper, if we say it hasn't reached priority for the journal, submit it elsewhere. Take it as a learning process, and if you're given information from some reviewers, take a good look at that and incorporate that when you do a resubmission. If we ask you to change your submission to a different format, we'd really love to see it back. Make sure you carefully read author's instruction and identify the article type. It's helpful to us if you do that up front and we don't have to ask you for a resubmission. And lastly, we had a sort of short discussion here on social media. We'd love you to use social media to amplify the work of your fellow authors and the journal contents, but use social media wisely.
That's great, Mino. So thank you so much. I will end the slides now so people can see both of us. And we have a lot of questions. So we have been bombarded with questions. When we start having the first questions, I stumbled a bit in the beginning. And I would like to ask you first. Many people, of course, they say about social media that maybe we were a bit discouraging, that in the sense that that was a strict, tough criticism on social media. I'm disappointed. Can I avoid or ignore that? And so maybe actually this question means that sometimes they receive tough criticism on the posts on social media. Also, from social media is what are the tips for promoting their research on social media? Twitter, Facebook, or LinkedIn, which is the most professional tool? And the last question that might be relevant, because I've grouped somehow the questions, is my social media promotions do not gather a lot of comments and shares. How can I do better? And how can I do international collaborations through social media?
A lot of questions. Well, firstly, how to avoid being criticized? I would just say simply, you're going to have to get over it. People, if you're going to post, people are going to say something, and so hopefully respectfully. But if you put out an opinion or sharing scientific information is one thing. People rarely argue with that. They might argue with the paper or the author, but they won't argue with you as the person who posts. So that's kind of the safest way to go if you want to kind of put your toes in the water and get used to social media. But if I put out, as a heart failure specialist, I never use drug X, I think it's dumb, I'm going to get some reaction to that from probably the other thought leaders in my field, but also other people. So if you want to mix it up a little bit on social media, get ready, because people will argue, hopefully in a professional way and respectfully. Not getting a lot of traction on Twitter has a lot to do with what you post and also how many followers you have, quite honestly. So if you have 25 followers, that means 25 people saw what you said. So whether you have any impact at all has a lot to do with how many followers you have, but it also has to do with how interesting something is. I'm always fascinated to see somebody who has a huge number of followers, who often has their voice amplified by others, put a tweet out or a Facebook post and nobody says anything. It's like, well, that didn't go anywhere. So it happens to everybody. So if you want people to notice what you're saying, you have to say something important. Something has to really matter. And collaboration internationally, I think, is easier than it used to be. I'll tell you that. So Dr. Graps and I have met each other probably, I don't know, in real life twice, and have collaborated on this journal. It's different than academic collaboration, but nonetheless, we live on different continents and has established a close working relationship. You can establish that through social media by connecting with people who are doing the work that you are interested in. One thing every senior investigator would love is somebody to do some work, like a collaborative partner who can actually do the big data dredge or look through a set of data. So don't be afraid, just as in when you're at scientific meetings that we used to all go to, where you'd walk up to an investigator who you might be interested in collaborating with. You might actually say, "Hi, this is who I am. Here's my card." Now, I reach out through social media and say, I'm really interested in your work.
Someone says, "How can I find you on social media, Dr. Walsh?" And it's at actually Mino Walsh. So it's
Right.
very easy. So you should start following Dr. Mino Walsh from today.
And Dr. Julia.
That we have more than 80 questions on so these people are answering. And so it is very interesting because they mention how they can discover interesting posts in their field on social media. And I would just start by saying that we have the hashtags. That's why it's interesting. And someone actually asked how they could trace their publication on social media, which is very interesting. The impact of their publication.
Well, that's, if you've published something, you can look at that altimetric. If you click on that in the journal, you can actually go to the tweets and the Facebook posts of your article. So if you can actually kind of look around and see what people thought about that.
So regarding the software that can help finding the right people on social media channels, I think these bots and the softwares that they exist in the market, they are a bit generic, so they do not identify the right people for heart failure. But those authors that they are writing, for example, I know that, let's say, Jim Januzzi is on Twitter, Dr. Papabit, that he also texted us, this is on Twitter. So gradually you will do the network through social media, isn't that? And for example, you follow many people of the heart failure ward. I follow as well a lot of people on the imaging ward. So starting following people, and then you can expand. The reason, I want to mention something important, Mino. I understand sometimes I'm a bit conservative on social media. Why? Because, as you know, I spent 5 years working for ESC as the ESC social media editor, and I was on my own at the very beginning. And it was not only crazy busy, of course, but we had a lot of limitations. So as you said, the patient, we received a lot of requests from patients. Would you provide, for example, guidelines for even patients asking us about their cases through social media?
Right.
So there is an enormous number of benefits. There is no doubt. And we love social media. However, also there is an important, as you said, an important number of limitations, and we always need to keep them in mind. As also my way of thinking is, to do original research is a very good way to connect with people, but also it needs the personal effort and for the young researcher to do original research. So isn't that right?
Yeah, collaborative research is very important, obviously, but remember, for those of you in university practice and those of you who are on promotion and tenure tracks, at least I'm just going to speak about US now, you want to focus yourself on being the first or the senior author. And so collaboration is great, but collaborating with enough people that you're one of 20 authors isn't really the impact to your career that another type of project where you might be, you might have, thought of the scientific idea yourself and you pursued it with data that you were in charge of.
Mm-hmm. And also, last question about social media is whether the journal will inform you if they promote your paper. What we're doing in JACC journals overall is when you submit the paper to the journal, then you submit your Twitter account, and then we tag the first author or the hospital that the author belongs to or they're affiliated to, and we are trying to promote the authors as much as possible. Or, of course, if you submit the case to JACC case reports and then you advertise that, it's always important for the authors to hashtag JACC case reports in order for the hashtag to circulate. Isn't that correct?
Right. So if you don't have a Twitter handle yourself and you're publishing, and you may have no interest in social media, but remember, your article will be amplified by others. And so if you don't wish to be on social media yourself, make sure that you know what the Twitter handle is and the information is for your institution, so that your work can be amplified.
Perfect. So just a short answer to a question, if we have any tips of making good images, any free software that I can use. Recently I discovered Adobe Spark that has also a free version. It's a nice software for creating illustration, and there are also some others in the market. Just I found that it's more user-friendly for the author who is asking. And I would like to address a little bit now the publishing part and about the cases, and not only, because we received a lot of questions about JACC journals in general. First of all, if authors can submit a paper to two journals at the same time, that cannot happen, because you sign a form practically that you mention that the paper has not been published or to be addressed in another journal. Of course, if you have submitted to the clinical case or the abstract, this depends on the journal, because some journals, they accept the submission of the paper even if the abstract hasn't been presented. Now, there is a whole discussion about the standards of quality, JACC journals, and the proportion of the rejection rate. And together we decide about the rejection rate, and that may fluctuate. I would say that the acceptance rate at the moment is 13%. And this is because we accept a lot of clinical cases. But I think it's important for me to explain to the audience, because someone actually commented on the transparency of the editorial process. And today I finalized a manuscript about the editorial process. I think it's important to explain how it moves. So I will spend 1 minute quickly, and then we can discuss on that. So the authors first, they submit their manuscript, and this will go through an initial quality process. So the editorial office makes sure that they have submitted they have respected the author's instructions, that the word count, the figures, and everything. And then it comes to the editor-in-chief. I review approximately 100 papers per week. You know how many we have. We have a lot of submissions. And then we decide together if I have any questions or if I'm in doubt, then we might discuss all together at the editorial board meeting whether this paper is worth going further. Otherwise, I will send it to you or to the associate editors, and then you will allocate reviewers to undergo through peer review. But the most important is that I realized within JACC journals is that we have this democratic approach of the editorial board meeting that we discussed all together. And we discussed based on the reviews that we got from our reviewers. My question to you, because I had a relevant comment, how about if the reviews are conflicting? Or if we, as editors, we disagree with the reviewers? There was also a very interesting editorial from Dr. De Maria recently, about a week ago, about this problem. So what is the influence of the editor towards the reviewers? What is the connection there?
That's a really good question. Well, firstly, so just to amplify what you said, Dr. Grapsa doesn't make unilateral decisions just like, I hate this paper, here it goes. It at least goes to one other associate or deputy editor to say, like, what do you think? And so some papers may stop right there, and they may be papers, just to underscore what was said before, do a literature search. Find out for sure if your case is that interesting, because one of the number one reasons that we're not interested in the case is that's well known. That really is one of the number one reasons that we don't accept a paper, is that it's well known, it's well described in the literature already, and it may be news to you, but we don't think it's educational. So if we send a paper out for review, we send it to experts in the field, so they have to know, something about it. And if we get diametrically opposed reviews, then we all talk about it together. And the associate or deputy editor who looks at it is generally in that field too. So sometimes, quite honestly, I'll say from my perspective, sometimes one reviewer put way more work into it than the other. And I tend to go with the one who did the detailed review and said, here are all my reasons why I think it's great, and this is how to, improve it, or here's why I don't think this is worth publishing. If I have that type of review, and then I also have a review that's very short that says, yeah, accept, then I think, I don't know if the reviewer, really had a lot of time to do this. So, but then we will also, the other thing that's important that we do on the editorial board is we ask the other specialists, like I'm in heart failure, but I might say, boy, I'm not sure about this paper. I want to ask my EP colleagues, does this make sense to you? What do you think? And so we have a lot of back and forth about that.
That's very interesting because, we are trying to explain to the audience how the connection between the editor, the associate editors, and the reviewers work. Also, an important component is that when one of us submits a paper, this is the policy across all the JACC journals. When, let's say, I submit a case report or a review paper from JACC from St. Thomas's, I'm sure that Dr. Fuster will never see the paper. And this is, or me, when a colleague of mine or you submit a paper, that I will never see the paper because it goes through a different process. It goes through the guest editor directly, the editorial office people who are exceptional. I have to acknowledge that they work 24/7. Even yesterday, it was a bank holiday there in the United States, and they were working and they're emailing me. So they will send it to the guest editor, and the guest editor will act as the guest editor-in-chief, and they will allocate associate editor and reviewers, and they will make the decision all together. So
that's a really important point. So just to rid anyone of the idea that the editorial board, which meets every week, can just slide their own papers in somehow because we're all kind of buddies. No, we never even see it. If it's one of the authors, we see it when it's published. That's the first time we ever see it. And then we can go back if we want and look at the reviews, but it's it's an entirely different stream of editorial process.
That's very, very interesting. So back to the case reports and how to write them. I received actually a few questions about the author's instructions. So it's very easy to identify them within the website. Even for JACC case reports, for example, if you go to submit, and then on the top of the screen, you will see author's instructions. And you can it's practically 5-10 minutes to read all of them and to decide the article type that is best for your manuscript. The same is applicable for all JACC journals. And I will address also on that part the question about the JACC journals that they exist at the moment and those that they are open access. So this is a very interesting question because open access at the moment are JACC case reports, JACC Oncology under Dr. Bonnie Key. And remember that there will be a new journal coming, JACC Asia, that the application for editor-in-chief is October 15th. And so this will be also open access. Now, the rest of the journals are the main JACC under Dr. Fuster, JACC Interventions under Dr. Moliterno, JACC Imaging, JACC EP, JACC Basic and Translation and Science, JACC Heart Failure. I hope I included everything.
You got them all.
So the open access policy, that means that because someone asked, can I download your clinical case abstracts through the Scopus? You can download the whole case from the website. And how do you see the open access policy, Mino? Because you can actually, the purpose of that is that the science is available to everybody.
Right.
So when you pay the publishing fees, practically your paper will be open to the world. Everybody can see that. And we want to address everybody, even the trainee who is in the developing country and they don't have the money to pay for a subscription to download the clinical case, because we feel that clinical cases, and exactly this is what we did during COVID. We waived the publication fees for that purpose because we felt that it is important to get everything out there and for people to demonstrate how they handle COVID. What do you think about this policy?
Yeah, well, it's amazing policy, and I think it's allowed, especially JACC case reports, to become a worldwide journal with people accessing this information. It's really a journal that's devoted to the development of trainees and early career people who can learn from these cases. So without it being open access, I don't think it would have the impact on scientific discourse and education as it has.
Mm-hmm. I completely agree with you. That is why the answer to a question that if you submit publication fees, if a case is rejected, no, it has to reach at the final stage. And for the publishing company to actually ask you for the publication fees. And practically when we establish the open access policy, we want to make it approachable for everybody. And I would like to clarify also something, Mino, because I can see now as we discuss, this year has been a transformation of me. I would say, I speak for myself as a scientist, as a human being, with all this experience. We have handled more than 3,400 manuscripts. It's enormous. And so to the people that they are listening, we are trying to help authors as much as possible. So I remember that at the beginning, we waived the fees for a case that the authors were coming from a developing country. And we always try to help a developing country. So it's not the end of the world. If your case is a great case and exceptional, and I always say, please do this step, submit the case to the journal to see how it goes, to see if we will go through the editorial process, because it's a peer review process that is subjective and it has to do with a variety of factors. Let it go to see how you will go through the peer review, isn't that?
Right. And also, let me just put a plug in here for, yes, we occasionally waive fees for in appropriate circumstances like that, but I will make a plea that you not email separately Dr. Gropsa and ask her to review your paper in advance of submission, because you're not really going to get in the back door. Even if I wanted to try to get into the journal, I wouldn't send her, hey, what do you think of this? That's not the way the editorial process works. She has a standard email now that she will send back to you that says, I'm very interested in your paper. Would you please submit it through the editorial process? So we're really interested, and that publication fee won't be decided upon until it's accepted. So I agree with you. Just go for it. Go for it and see what the editors think.
And Mino, this is interesting because I truly believe that emailing me, I don't mind, for example, when they text me on social media, because I think that's the cost of having a social media account. However, what I say is that it is unfair for everybody, for us, for the one who is sending the text, but most important for the other authors that they don't have social media.
Right.
So
you think it might get you in, but it actually might not, because you might anger the editor-in-chief. So just do it the right way. If you have a great case, put it in there. Or if you have a great Voices in Cardiology that you have an opinion, we really want to hear it. We want to see it.
First of all, I have the high threshold now after all these years of patience, so it's good. But since you mentioned the article types, I received an interesting question about the global health reports. And we create this section because we really are interested in the developing countries. And a clinical case of let's say I will mention an example, a clinical case of an Epstein's anomaly might not be interesting if it's coming from, let's say, United States. Sorry, with all the respect, Mino, but you know what I mean. But an Epstein's anomaly, a series of anomalies that we received from Africa, from a developing country, and how they manage these patients with the least of resources. For us, we could help the authors develop that in a great paper that will address the world. So, isn't that so? What do you think that it's how can we encourage more authors submitting to global health reports?
Yeah, I think it's an important point that we're really interested in how disease manifests itself in other parts of the world. And we might not publish something from the United States that we would be very interested in from somewhere else. So, and our COVID issue was an example of a worldwide information flow that came to us. and from all over the place. And we were able to see as an editorial board just a fascinating assortment of how COVID was presenting in the various countries of the world and when, and how they use their resources. So those type of papers we're very, very interested in.
Mm-hmm. I have an interesting question that, Mino, you are the best person to answer this question. So the author asked this. Usually basic science studies get more citations than clinical studies, patient studies, because people working in the area of basic science have more time to do research and writing. I had the same question when I was 10 years younger. So, do you think that we need to do basic science studies to publish in high-impact journals?
No. I think you are who you are, and if you're a clinician and you're doing clinical science along with patient care, you're right. Maybe you will publish a fewer because you have clinical work. You're on call. You're rounding in the CCU and doing things, but that's our life. And I mean, it all depends on what you want to do with your career. I love clinical medicine. I'm not going to stop just because I'm also writing a paper, but I have a firm belief that if you want to write, if you want to submit to journals, you will do it, no matter if it keeps you staying up at night or not. But I'm not sure I agree with the hypothesis that basic scientists, they may have citation rates in certain journals, but not in our clinical journals. They don't. The citation, the impact factor the citation rate of clinical articles is very high. The guidelines, for those of you who aren't in the publishing, business, the guidelines get the highest citation rates for most journals.
That's true. And clinicians like you, of course, you have participated in a lot of clinical trials. So there are other ways for someone to develop and to publish in high-impact journals. As another question was, how often do we need review papers? Are they important? For example, if you have a young physician, would you advise them? 3 options. We have 3 options for a young physician who is a trainee. 1, to start writing clinical cases. 2, to start writing reviews. Or 3, to start working on original research. What would be your priority as a mentor?
The review's the last one on the list. So you can to entertain yourself, send in cases. That'll make you a better writer. You'll get used to the format. You understand publishing. You'll have a few early wins, maybe. Original research is how you're going to make your name. And so whether you're involved in a team where you're working with a mentor and you may end up being the first name on the project while the senior person is the senior author, that's very productive. And the third thing is the review paper. And the review paper is an excellent way to go if you're the first author and do the first draft and most of the work, and your senior author is somebody who's well established in the field, because no one's going to read a review article that I write about interventional cardiology just because I looked up all the data and I synthesized it and I thought, okay, I'm going to write this. I'm kind of going off into a different field. No, nobody cares what I think about it. So a perfect review article is if you can write it with your mentor. But as far as your academic productivity, your original research is the most important.
Mm-hmm. That's very interesting advice, because we have a lot of trainees watching this. A question, if you do not agree with reviewer comments and suggestions, how do I respond? And
Julia, why don't you answer that? You're the editor.
No, we receive, sometimes we receive appeal. So if you completely disagree with the decision of the journal, why don't you send the proper appeal with your opinion and why you think that the reviewer's comments are not valid, and to the journal, JACC at acc.org. That's the basic email. And then we are all receiving that. For example, we discussed at the editorial board meeting, so it goes under the second round of discussion. And of course, if we feel that there is an option that you can improve the manuscript, but we will provide with constructive feedback. What do you think?
Yeah, and if you're reading the reviewer comments and you're like, say you're asked to, maybe you get like a revision decision and you think the reviewer, it doesn't make any sense on a particular point, it's okay to very politely say, I'm not really sure what I don't, or you can say things like, I'm not sure that the reviewer, I'm not sure we made it clear to the reviewer what we meant, and then restate it. So there's occasional times where a reviewer might have missed a point or made a point that wasn't really relevant. So you can just be very polite. I will tell you that the best responses to reviewers are ones that are kind. Well, first of all, the best reviews are kind also. They're not mean, and they don't say things like, I can't believe you did this. But the best response back is, we thank the reviewer for that comment. I mean, begin every sentence like that, because, peer review doesn't come with a salary. So this person really took some time and looked over your work and probably made it a better paper for you. So thanking them. And if you don't agree, like if they ask you to redo a statistical analysis and you don't agree, then you can write to the editor-in-chief and say, we have a statistician who disagrees with the statistical review. That sort of thing can be done. So feel free to ask, because and the appeals, I don't know, Julia, do you know? I think most appeals don't stand, but maybe a few have over the past year or so.
We had few appeals, but I must admit that the authors did not manage to prove us that the case that the reviewers were unreasonable, because we got great reviews, let's say 1 page, 2 pages long, and there are a lot of comments. So we had, for example, an appeal that I discussed recently with a colleague editor-in-chief, because I was questioning, and he confirmed as well that the reviewers were correct. So it's variating, but we still give the opportunity to the authors to appeal if they wish. So that's another tool for fairness, because that's our priority.
Right.
Now, an interesting question is, what are the valid reasons to ask for a reviewer to be excluded from reviewing your manuscript? That's an interesting question. And do you always honor this request? We do. Personally, I'll be honest with you, I do, because if when I submit a manuscript of mine, I have in my mind, let's say, one person that maybe they could be strict with the review, but I don't do it, because I don't include this person as exclude reviewer, because I think that will give a bad impression to the journal. Does it give a bad impression according to your opinion? When I see others, when I see people say exclude this reviewer, I don't mind, because I understand that we have a big number of young people, and they might have a conflict of interest. They might have had this person, senior person, in their career, and they might have been a bit strict. So I completely understand. And I promise to you, whoever asked this question, that I always honor this request, and we do not include this reviewer to simply reject your paper. But what do you feel about that, Mino?
Well, I think it's reasonable if you feel that there's an individual who is, I don't want to say out to get you, but has been very negative about your work in the past. That'd be a reasonable request, but we wouldn't want to see a list of people who you don't want to review. I mean, occasionally somebody says, these are the people who would be best to review, and that's fine. But I think if there's 1 or 2 individuals in your career who've really offered nothing but negative input, that's a reasonable request of an editor.
Mm-hmm. So, Mino, I'm going through the questions, and I tried to group the questions, and we have addressed most of them. So I would encourage actually the people. So a few questions: how can I access JACC case reports? Is you will easily Google JACC case reports, and it will come in front of you. So it's very easy. The platform is open access. And also a last thing to advise is that this webinar that is recorded, you will be able to see that to watch that afterwards on demand. And also we have recorded a YouTube video under the American College of Cardiology YouTube account with Mino a year ago, almost actually 18 months ago. Time goes by with COVID. And So this could be a very good first step before you submit the clinical case. So any final tips, Mino, to the people listening?
One last tip that comes up a lot, and so when you're thinking about submitting your case, remember, it should be new or educational, not just new to you. So in addition to doing the literature search to see how common whatever it is you found is, also be aware that you kind of have to have all the data about your patient. For example, if your patient died and you think the patient died of this unusual thing that you are reporting, we're not going to be that interested unless you can prove that. So we occasionally have this where we don't have pathology, we don't have slides, we don't have the final imaging. And so if you assumed it was disease X, but you can't for sure say it, that's probably going to be a no. So that's kind of a final tip that we love the pathologic findings or the imaging findings that were definitive, that sort of thing.
That's great. So as the last bit, I would like to acknowledge all our colleagues in the journal, the editorial board members, the associate editors, reviewers, but also the editorial office. And as I mentioned many times, if you have any questions, we are here to help you. So email JACC case reports, the email that is very easy to find, and our editorial office is there for you. And also if you say, I would like to have a question for Dr. Walsh or have a question for Dr. Grabsa, they will forward us your questions. Right. That's the proper way.
Yeah. Right.
Thank you so much. Thank you, Mino, for this great discussion.
Great opportunity. Thank you.
Thank you.